Hello everyone and welcome to our webinar entitled Ethics Update of Clinician Bias in Forensic and Therapeutic Assessment and What to Do About It. My name is Dr. Norton. I'm the Executive Director of the National Board of Forensic Evaluators. It's exciting to be here with you all again today. I'd like to start off by taking kind of a pulse of who's in the room and launching a few polling questions. Looks like we have a lot of members of ACA and AMCA and the APA, and certainly about half of you are connected in some way to the National Board of Forensic Evaluators, either because you're certified by us or because you're pursuing certification. As far as your work roles go, we have about a third of you are forensic evaluators. 18% are administrators or supervisors, got a couple researchers and students in the room. But 94% of you do at least some therapy in your work. And then about 12% of you said that your role is other. And then for the third question about professional identity, 88% of you identify as counselors, but we also have some marriage and family therapists and also psychologists in the room, and some folks said other as well, it looks like. And we have set up this webinar so that hopefully it will be applicable to all of you, whether you're a forensic evaluator, a counselor, or a social worker working with clients in the forensic arena as a helping professional, or whether you're a therapist in clinical practice, or you're just anybody else who's interested in the topic of clinician and evaluator bias. We're going to cover controversial topics today, obviously. We're going to talk about it all. We're going to talk about politics, religion, sex, gender, race. We are going to talk about worldview and morality. So there's certainly going to be controversial topics. And my hope, though, is that you get the sense that as I move through these different controversial topics, that it is a very non-judgmental process, that there is a great deal of room to create an open environment where people can explore some of their beliefs and their biases and impact the work that they do. And there's always a popular question, how do you get handouts? Everything that you see on the slides, you will have available to you in a PDF form that includes hyperlinks. So every time you see this red underlined font here, that is a hyperlink that you can click on in your PDF and be redirected to an online source. So here's the handout link. It is nortonconsulting.box.com/VAs-Victor/NBFE-bias-2022. In addition to the slides, there's an article in there, and there is also, a reference list, a full APA-style reference list for all of the resources used today. My email address is on the left-hand side here, aaron@nbfe.net. So if there are questions that we don't get to, then feel free to send me an email and I'll be glad to respond to them. Sometimes it'll take me a little while to get to them, but I will eventually respond if you send me an email. I'm the Executive Director of the National Board of Forensic Evaluators. As I said earlier, I'm a licensed mental health counselor and licensed marriage and family therapist and a certified forensic mental health evaluator. I'm a visiting instructor at the University of South Florida's Department of Mental Health Law and Policy, and the Southern Regional Director for AMCA. I'm chair of the Government Relations Committee for FOMCA, and I'm the liaison between the AMCA Ethics Committee and the Board of Directors. So some of the things that we'll talk about today are going to be very relevant to those experiences that I've had in some of those positions, and also to research that I've conducted on bias within the mental health professions. So what we're going to cover today, we're going to talk first about more broadly bias among mental health professionals, including in clinical settings where individuals are providing therapy for clients. We'll talk about some implications for bias. How does it affect us in our field in a variety of ways? We'll get specific about bias among forensic evaluators as well. And then we'll shift into strategies for addressing bias. Then we'll talk about an area of research of mine, political dysphoria, and how political dysphoria can be addressed or countered, and then some resources that you can use to learn more if your curiosity was piqued and you're really interested in finding out more about these topics today. So now we're going to use the Poll Everywhere polling questions to ask you 3 polling questions, which will factor in to an exercise later on in the webinar. So you really want to participate in these 3 polling questions if you can. The question is, what percentage of mental health professionals do you think identify as politically liberal? Looks like so far your most popular answer is 70 to 79% of mental health professionals identifying as politically liberal by your guess, but we have a lot of people who are giving some other answers as well. But now we're going to ask kind of the reverse question here. The next one is, what percentage of mental health professionals you think identify as politically conservative? And what we're kind of seeing here, as we are probably not too surprised to find, is that your answer is very different than the previous question. Your most popular answer for this one is 30 to 39% of mental health professionals identifying as politically conservative. Here's the last polling question before we get into some of the slides here. If you had to choose one of them, one of these three options, which of the following labels would you use to describe your political ideology? All right, and right now we have 25% of you saying that you would use the word conservative to describe your ideology, 42% say moderate, and 33% say liberal. I will tell you, these are different numbers than I usually get when I do this training with a national audience. But we'll talk more about that later on. All right, we'll give a couple definitions here so we kind of know what we're talking about on upcoming slides. If you look at the dictionary, Merriam-Webster dictionary, the word bias means an inclination of temperament or an outlook, or it could mean an instance of such prejudice. Now, in that sense, if we look at this word, this definition for bias, an inclination of temperament or outlook, or maybe even a prejudice, my firm belief is that everybody is biased. We all are biased. We all have biases. That's normal. That's perfectly human and natural for people to have biases. What concerns me more is when people say that they don't have bias. And I think the reason they do that is because they're so used to hearing the word bias used in a very pejorative and negative way that it makes it kind of hard sometimes to admit or acknowledge that we have bias, but we absolutely do. We all have biases. And there's also a term, implicit bias. Now, the National Institutes of Health recently defined implicit bias as a form of bias that occurs automatically and unintentionally, but it nevertheless affects judgments, decisions, and behaviors. And again, I would say that based on this definition, I don't see how it is possible for any living, breathing human being to not have implicit biases. We do. In fact, not only do we have implicit bias, but we need implicit bias for survival. There's a reason why sometimes our brains make automatic snap moment judgments without us consciously thinking about it. And it's because it's necessary for safety and for survival. I mean, if you're driving down the road and you see a car in front of you and that car seems to be swerving and now it seems to be moving into your lane, without you consciously thinking about all the possibilities and weighing things out, your brain is saying, dangerous, this is a problem, something's about to go down. And it may even be saying something negative about the person in the other car in that moment. That is perfectly normal, human, natural, and perhaps necessary for human survival. Now, question is, do we at some point become aware of our bias with a little bit of time and space to be able to think and reason through and engage in a secondary appraisal process? And that's the world where cognitive behavior therapists, for example, really spend a lot of time, is that secondary appraisal process. But we all have the initial response, that initial bias within us. Now, there are so many different things we can be biased about. And an argument is that all of these things, politics, religion, spirituality, philosophy, morality, culture, race, ethnicity, socioeconomic status, education, intelligence, gender, and sex, and 100 other things that you don't see on this list, are all kind of connected to a broader construct of worldview. It is, what are my schemas about life, the universe, people, humanity, everything, all of it. And we have to have schemas. That's part of being a human being. So we've got worldview, and that worldview informs a lot of our thoughts and our decisions and behaviors connected to so many of these difficult and controversial issues. And the point is, many times this will happen without our conscious awareness. Now, let's start with looking at some research about bias among mental health professionals. Before we really get into the research, though, let's look at our codes of ethics and what they say about our ethical obligations in terms of bias, cultural identities, beliefs, and values. Bottom line is, with all of our codes of ethics, we're going to see that we are called upon to constantly and continuously be examining and exploring our own biases. We have to do the brave thing and ask ourselves, where are my blind spots? How do I become aware of them? In what ways am I biased? How does it impact the work that I do? We are constantly supposed to be asking ourselves that question, not because we believe that it is wrong for people to have biases, or necessarily that we're assuming that the biases are always a bad thing, but because it is our responsibility, our duty to ourselves and to the people that we serve to constantly be involved in a process of internal exploration. But in addition to being aware, we are also called upon to avoid imposing our own values, attitudes, beliefs, and behaviors onto others. I will tell you that is virtually impossible to do. And what I mean by that is, if you even examine counseling theories, like if you, for example, are a humanistic counselor, or a psychodynamic counselor, or if you are a solution-focused counselor, or you're a cognitive behavioral counselor, and you're true to a theoretical orientation, then you are kind of by definition, when you're using certain interventions and techniques, imposing in some way your own values and attitudes and beliefs onto clients about how people get into trouble, for example, and what helps people, and what approaches will tend to work. So it's not truly possible to fully avoid imposing values, attitudes, or beliefs, except to the extent that a person could say, well, if I'm just using a counseling theory and I'm using a process of informed consent, and clients are they're aware of a theory or approach, and they're voluntarily signing on to it, well, then I'm not really imposing a value, attitude, or belief. But the reality is you constantly are. Every time that you challenge a client's worldview, even in a gentle way, even in a very supportive way, you run that risk, at least, of value imposition. So it's a lot easier said than it actually is done. And it happens all the time in the therapy room. The ACA code says some very similar things. We respect our clients' autonomy, their cultural identity and beliefs, their worldviews, and we also refrain from referring clients to other people, or from not working with them or abandoning them in some way, strictly because they believe differently than our own personally held values, attitudes, beliefs, and behaviors. The AMCA code, the American Mental Health Counselors Association, also calls upon us to be aware of our own values, attitudes, and beliefs, and to avoid imposing them on clients. And the National Association of Social Workers, in their code of ethics, they call upon social workers to understand their bias and to engage in a form of self-correction. Psychologists are also called upon to become aware of and to respect cultural, individual, and role differences, including age, gender, gender identity, race, ethnicity, culture, national origin, religion, sexual orientation, disability, language, socioeconomic status, and to try to eliminate the effect on their work of biases based on those factors. Now, a lot of these codes, especially the ones in the counseling profession, the ACA and AMCA Code of Ethics, were revised in the 2010s to strengthen the verbiage about not abandoning clients based on a values conflict between counselor and client. Why did they do this? They did it in part as a reaction to two court cases. The first, it was Ward versus Willabanks in 2009. A graduate student, I believe her first name is Julie or Julia, I can't remember which one, but Ward is her last name. This graduate student questioned whether she should refer a student seeking counseling from her for depression related to a homosexual relationship because of a clash between her evangelical Christian beliefs and the client's sexual orientation. Now, to be clear, she wasn't saying, I want to work with this client and I want to teach them that homosexuality is sinful and wrong and immoral. She was more saying, I don't think I'm the right person to work with this client because of a conflict with my personal values, and she wanted to refer the client out. But she was then referred to the university's remediation program and eventually dismissed from her counseling program, but she appealed. And initially she lost the case, but then on a higher court of appeals in the Sixth Judicial Circuit, she was winning the case, and the Sixth Circuit rebuked her university for permitting secular exemptions, but not religious ones. And the university actually settled outside of court with it having to go any further. But there's a second, slightly different case in 2011, 2 years later, Keaton versus Anderson-Wiley. A student at Augusta State University sought a court order requiring ASU to reinstate her to her master's program, where she maintained that she had a religious right to counsel clients that homosexuality is immoral. So this is different than what Ward did, because she's not saying, I want to refer this person out because of a values clash. She's saying, I want to work with this person, but also counsel them that homosexuality is immoral. She lost her case in the 11th Circuit, where her university's right to require students to adhere to the ACA Code of Ethics was reinforced. These are slightly different cases, but different results at the end, creating some confusion about what happens when universities try to hold students accountable to the codes of ethics that we just saw on those previous slides. So in 2014, ACA, the American Counseling Association, reacted to these two cases by revising its code of ethics to strengthen its position on the importance of counselors recognizing their biases and to avoid value imposition on clients. But then that triggered a counter reaction from various state legislators. In Tennessee, 2 bills were passed allowing counselors to discriminate against lesbian, gay, bisexual, transgender, and questioning clients. And in 2016, ACA reacted by saying, well, fine, we're canceling our conference that was going to take place in Nashville, Tennessee, and we're going to go to San Francisco instead, which triggered a counter reaction by Tennessee, introducing a bill that said that they could write their own counseling code for their counselors. Thank you very much. And also in Mississippi, legislation was actually blocked, but point is, people made an attempt to permit counselors to deny services to LGBTQ clients. And then in Ohio, House Bill 658 in 2018 would require professional counselors and teachers to out transgender children and youth to their parents, according to the ACA. So what you can see here is when sometimes an association tries to react to a court case, it can trigger a legislative process among various states. And then there's kind of this back and forth that goes on, sort of a tit for tat process, it seems like. Now, I became interested in this topic in part because I participated in a study in 2017, or that was published in 2017, with some colleagues at the University of South Florida. And this is when I was a doctoral student. We worked with 163 participants, all of whom were mental health professionals in training. They were graduate level students in mental health counseling, and I think social work, if I remembered right. First, we surveyed them. And in surveys, they said, and the question was sort of about whether they have any particular biases or preferences with respect to the race, gender, and sexual orientation of parents wishing to adopt an African-American child in a case scenario. So we have a child, the child is African-American, this child is up for adoption. Do the mental health professionals in training say that they have any preferences or biases about the race, gender, or sexual orientation of potential parents for adopting this child? Well, they said, no, we don't. We don't have any biases about that. But then we used an implicit association test protocol to try to determine whether they had implicit bias, regardless of what they say explicitly. And for some of you that might know about these IAT processes, the way it works is there's a training phase where you have different words or images that flash on a screen. And you got a good button and a bad button, basically. And you have to make a split-second judgment because you only have a brief moment to do it, to hit one button or the other. And you got to move so fast that after a while, you can't consciously think through things. You just got to go with your gut after a while. And then eventually the images start to shift and they become images of different configurations. For example, you might have a configuration of 2 adult white women with the Black adopted child, or you might have a white woman and a Black male with that child. and various configurations of different skin colors and different genders of the parents and the child. And then we look for, okay, are they hitting the bad button more for certain groups than for the good than for other groups? And are they doing so in a way that is statistically significant? We did find some evidence of implicit bias. Now, our hypothesis was that mental health counselors in training and other mental health professionals in training, that they would be biased towards heterosexual couples adopting this child. That was our hypothesis. But to our surprise, that is not what happened. What we found is that the bias was towards a lesbian couple. That people most trusted two women and that child, more so than a man and a woman or two men. Now, there was a moderate to strong preference for lesbian couples over gay male couples. But the bottom line is the strongest preference was for two women. And this opens the door for the question, once you throw a man into that parenting or adoption or fostering scenario, then do people automatically trust less? Do they have more negative attitudes or beliefs about men raising children? That's sort of the question that arises from research like this. So this got me interested when I was a doctoral student. One of the things that I did leading up to my dissertation was, of course, to do a good, thorough research review. And so let's take a quick walk through some of the studies that I researched. First, Barrett and McWhirter, 2002. They correlated client homophobia with the use of negative adjectives for gay men in clinical vignettes. So what they did here was they gave mental health professionals these different vignettes, and they were randomly assigned to different groups, and they would simply change like the gender of the people involved in the scenario or their sexual orientation. And then they would ask mental health professionals to write about, the kind of a case synopsis. And they found that mental health professionals use more negative verbiage if the only thing we changed in the client vignette was the sexual orientation of the person involved. That's all that we had to change, and their words that they use would become more pejorative and negative. They may not be aware of that, obviously, but it's a statistically significant difference. Bloom and other researchers in 2016 found that mental health counselors and marriage and family therapists who believed that pornography could be harmful to clients were more likely to assess for problems related to pornography and therefore more likely to treat those problems. So this isn't necessarily a good thing or a bad thing. You could argue it's a very good thing. If you don't think that pornography is potentially harmful, then you're probably less likely to be including that in a biopsychosocial assessment, and you're probably less likely then to know whether the client identifies it as a problem and something that ought to be included on a treatment plan. That was sort of their implications for this study. Parikh and other researchers in 2011, they were examining school counselors, and they found that school counselors who had lower levels of belief in a just world. So in other words, belief in a just world means it's the belief that, generally speaking, if you do good, then good comes back to you. Because, the world is pretty just all in all. That's the idea of belief in a just world. Now, school counselors who had lower levels in that belief. So in other words, they think, well, the world's not just, it's not fair necessarily. They were more likely to engage in advocacy behaviors for their clients than those school counselors who had a higher level of belief in a just world. Other researchers in 2009, 741 members of AAMFT, the American Association for Marriage and Family Therapy, they found that participants with higher levels of homophobia reported lower levels of competency in working with LGB clients. Now, by the way, I should say with each of these studies, they're not just asking people, how competent are you? Or how homophobic are you? They're administering instruments that have been researched and validated that try to assess these constructs. And then they're looking for statistical correlations between scores on these measures. Bedell, 2014, establishes an inverse relationship between religious fundamentalist beliefs and the self-reported competency of working with LGB clients. McBride and Hayes, 2012, 360 counselors in training and master's and doctoral level counselors working in the field. They found a significant and negative correlation between ageist attitudes of counselors and their self-reported level of multicultural competency. So in other words, if on a questionnaire I'm scoring high in ageism beliefs, then I'm likely to have a lower level of multicultural competency. The two seem to be statistically connected constructs. 2017, multicultural counseling competence was predictive of counselor individualistic and structural poverty belief. Two studies in 1998 and 2002 of psychologists. Psychologists reported that their religious beliefs moderately or significantly influenced their practice of therapy. So they're saying, I'm aware that my religious beliefs impact my work as a therapist. And that could be good, that could be bad, that could be both, it could be neither, it could be all of the above. 2014, a narrative analysis and review of 29 articles published in peer-reviewed journals, concluding that therapist religiousness and spirituality positively correlated with all of these: favorable attitudes towards incorporating religiosity and spirituality into therapy, higher probability of implementing spiritual or religious interventions, higher levels of conservative social values, and lower levels of support for unconventional sexual behavior. So you can see how the case is building over time that our beliefs about different things, religion, spirituality, age, all kinds of things, are impacting the work that we do. And to a great extent, a lot of people are aware of that impact. Garb, 2021, conducts a research review concluding, and this research review is looking for evidence of race bias and gender bias in diagnosis. In this exhaustive review, Garb concluded that there's evidence for race bias for diagnosis of the following disorders: conduct disorder, antisocial personality disorder, comorbid substance abuse and mood disorders, eating disorders, PTSD, and differential diagnosis of schizophrenia and psychotic affective disorders. To give you an example of this race bias, what Garb was able to demonstrate in a research review was that, on average, African American males will evidence depression differently than other people will, and therefore exhibit different behavioral patterns that will lead to a greater likelihood of being misdiagnosed with a disorder other than depression. That's just an example of the many cases of race bias that were included in this research review. Also found evidence of gender bias in the diagnosis process for the diagnosis of autism spectrum disorder, ADHD, conduct disorder, and antisocial and histrionic personality disorders. So we, up to this point, have some evidence then that if we believe that certain things are more immoral or harmful, we're likely to ask different questions in assessment and include different things on our treatment plans. We have a perception, a belief that our religious and spiritual beliefs and attitudes have an effect on our theoretical orientation, on the work that we do with our clients. We have evidence that when people think they don't have a bias consciously, or they're unable to acknowledge it, that implicitly that bias still exists and can still affect them in some ways, obviously without their conscious awareness of it. But there's also qualitative research. Quantitative research generally asks us like what questions, and then qualitative research sometimes gives us a deeper picture into the whys and the hows of certain things. So let's just take a look at a few qualitative studies here. 9 mental health professionals in the UK interviewed. They discussed a perception that their spiritual beliefs enabled them to better cope and self-regulate in sessions and to be more present and engaged with their clients. They also believed in the importance of not imposing their spiritual beliefs on clients, but also expressed that it's sometimes tempting to do so. They also disclosed a tendency to find some ways to incorporate their religious and spiritual beliefs into their counseling theories. Minix, 2018, 15 counselors identifying as Christian, heterosexual, and male. Question is, how do Christian heterosexual counselors who once perceived LGBT affirmation to conflict with their religious beliefs go about effectively reconciling this conflict to become LGBT affirming? And so the participants said there are obstacles to becoming affirming, including the risk of rejection by loved ones within their own families and their own social circles and faith communities, and the internalized importance of not questioning God. But this research also sort of, Minix argued, suggested that Christian counselors who experience an internal conflict when working with LGBT clients can reconcile that conflict. They can still provide quality work with clients in spite of that internal conflict. There are ways that they seem to do that. Morrison Borgen, 2010, interviewed 12 Canadian counselors who believed their Christian beliefs influenced their counseling. And they identified 242 incidents in which they believed that their religious beliefs or spirituality helped them to empathize with clients, and 25 in which they believed that those beliefs hindered the ability to emphasize. So I want to say something here. Our biases, whatever they may be, and in this case, religious or spiritual biases, they don't necessarily always have a negative effect. Sometimes they may have a positive effect on the work that people do with clients. But still, what seems to be important is becoming consciously aware of those biases and the ways that they can affect the work that we do with our clients. Now, here is a graph of American ideologies by year. What we're going to do is compare the ideologies of American citizens with our own in this very group here. And we're going to do that by using your answers to the question on that polling question about political ideology. So give me a minute to plug those numbers in, if I can get it to work. All right, we're going to do conservative and moderate, moderate's going to be here. And liberal. This is, I mentioned to you all, a very different group than what I normally see when I do this training with a national audience. Because you all aren't very far off from being representative of the American population with this polling question, at least when we look at Gallup polling data. Because these are the political ideologies of Americans, and these are your political ideologies as a group. They're not dramatically off from each other. Yeah, we've got actually a little bit more moderates in our group compared to the national average, but the conservative and liberal ratios aren't dramatically different. We're a little bit less conservative. That's probably the biggest difference is we're a little bit less conservative, I think by about 10% than the national population. Normally, when I do this training with a national audience of mental health professionals, what we see is a much smaller conservative slice than what you all represent, a much larger liberal group, and a relatively small moderate group compared to the national average. So you all are a little bit unique in this audience. Now, I conducted a few studies. One was in 2019 with Tony Tan at USF. Well, before we get into those, actually, let's look at what some other researchers have done. Pretty much, the bottom line is that in the mental health professions, we are anywhere from 2.5 to as much as 7 times more likely to identify as politically liberal than as conservative politically. And that is very different than the national average. As a whole, mental health professionals do not seem to be representative of the people that they work with in that sense, in terms of political ideology. The two studies I participated in, we published one in 2019. These were strictly 467 licensed counselors in the state of Florida. And in our study, counselors were 2.3 times more likely to identify as Democratic than Republican, and 2.6 times more likely to identify as liberal or conservative. Another pool of research in 2021, I used members of the American Mental Health Counselors Association who were actively licensed. 51% identified as liberal and 20% as conservative. So you can kind of see the overall constellation for counselors based on that first study in Florida. This one's a little bit different than what you saw on the political or on the previous slide, because here I gave lots of options for political ideology. You could say you're communist, socialist, libertarian, moderate, conservative, or liberal. But the bottom line is that our sample was much more politically liberal than the average for the US population. Also, we gave people a questionnaire of different political beliefs, and then we used something called the Nolan chart to organize them into different political ideology quadrants. This gets a little bit technical, but here's the bottom line. You got a conservative quadrant. This would be a low level of endorsement of beliefs related to social freedom, but a high level of endorsement of beliefs related to economic freedom, the freedom to choose to spend your money the way that you want to spend it, essentially. And that includes lower taxation and that sort of thing. The libertarian quadrant is high in freedom across the board. These are individuals who endorse a high level of beliefs for social freedom and economic freedom. The communitarian, or some people say communistic quadrant, is low in both freedom zones. And then the liberal quadrant is going to be high in social freedom, but low in economic freedom. And these are all of the people that we surveyed, where they landed on this chart from this political beliefs questionnaire. And this is their average. So what this would suggest is if you take us all on average, we may be on average lean slightly in the liberal quadrant, but still kind of moderate overall. All right, so we've walked through some research, and that research looked at bias among mental health professionals. And then we looked at religion and spirituality. We looked at political beliefs and ideologies. We looked at ageism, race, implicit bias. Does it really matter, though, when it comes down to it? Like, is it really that big of a deal? What are the implications for this bias? Well, we then decided, well, does this bias really, is there evidence that it impacts counseling theories? For example, in terms of political ideology, and also religiosity, religion and spiritual beliefs, is there evidence that psychologists with different political ideologies or religious beliefs will prefer certain counseling theories? So there was a study, 2002, 282 clinical and counseling psychologists, and they did find some statistical relationships. Political liberalism predicted commitment to humanistic counseling theory and to psychodynamic theory, but also older age, female gender identification, and lower levels of agreement with Eastern and mystical religious beliefs were connected to higher commitment to humanistic counseling theory. On the other hand, younger age, conservative Christianity, and higher belief in science predicted a greater adherence to cognitive behavioral theory. And you might think of those as being very different things, because they are. But it's interesting that both conservative Christians and people who have high levels of belief in science and the scientific method, even though you may think of them as being very different groups of people, and they may be very different groups of people, but both groups have a higher level of preference for cognitive behavioral theory than others. Now, what we did, though, in 2019 and 2021 is we said, what about counselors? And we controlled for age, sex, the number of years licensed, and ethnicity. And we found that counselors who identified as conservative were registered with the Republican Party or who endorsed high levels of libertarian beliefs had a stronger preference for cognitive behavioral therapy compared to others. We also found that counselors who identified as liberal in their political ideology were more likely to prefer psychodynamic theory, and that counselors who reported a low level of libertarian political beliefs were more likely to prefer humanistic theories. Now, having said that, that all sounds like kind of a big deal, right? But here's another thing in that study that I really stressed, and I think to some degree was de-emphasized in the editorial process, and it's this. Liberal counselors, so counselors who identify as being politically liberal, still most preferred cognitive behavioral theory above all of the other counseling theories, just like conservative counselors did. It's just the conservative counselors preferred it even more than liberal counselors did. That's the only difference. So is that really a dramatic difference when it comes down to it? And does it really matter in the grand scheme of things? Who knows? But in 2021, we took it a step further and we said, okay, so we know that there's some relationship between somebody's political ideology and their preferred counseling theory. But what if we gave them clinical vignettes, clinical scenarios that involve politicized issues? And then we gave them options for things they could include in a treatment plan. Would we see that a counselor's political ideology makes a difference in terms of how much they intervene with a politicized problem, as evidenced by their likelihood that they would include certain treatment plan objectives in their work with that client? It gets very complicated the way that we did this, and there are some flaws in the way that we did it, and there could be other ways to do it that are very valid. But bottom line is, we discovered that conservative counselors rated the level of seriousness of clinical vignettes higher for two and only two politicized issues: gun storage and abortion. They didn't rate seriousness higher, they just rated it differently. Specifically, conservative counselors thought that the gun storage scenario was less serious compared to other counselors, and they thought that the abortion scenario was more serious than other counselors did. Republican counselors, so counselors who said that they were registered with the Republican Party, intervened at a different level for vignettes involving one politicized issue, and that was tobacco use, and one non-politicized issue, and then one politicized issue, which was gun storage. Now, let me show you, though, the bigger picture here. First, what we see here is this is how serious, on average, do counselors find these vignettes that we gave them to be involving certain politicized and non-politicized issues. We thought that these vignettes would be non-politicized. We didn't think we would see a difference between counselors of different political groups for how serious they thought these issues were. We thought these would be different between the groups. That was the hypothesis. But what I actually found is only for two of these was there any statistically significant difference based on political ideology or political party. And very specifically, they were gun storage and abortion. So there's no difference in seriousness, perceived level of seriousness for the marijuana vignettes, the lesbian adoption vignettes, or a client coming to you for a mental health evaluation as part of a process to get a gender reassignment surgery. We were surprised to find that, for example, conservative counselors didn't really intervene in any more than liberal counselors did for the treatment plans for those clients. Also, the only relationships were connected to political ideology, not political party. So Republican counselors as a group didn't do anything different than Democratic counselors did, or they didn't perceive the level of seriousness to be differently. Now, as far as treatment decisions go, we only found differences in gun storage and tobacco. And that was only for political party and not political ideology. So the point I'm making is, even though there were differences, by and large, the differences were small, and they didn't even exist for most politicized issues, for both political ideology and political party identification. So what we're kind of finding is there's very limited evidence that it makes a big difference in terms of counseling theory and in terms of treatment levels, perceived levels of seriousness for clinical vignettes involving politicized issues, and for treatment interventions that counselors would select. There are differences, but they're probably not dramatic in the grand scheme of things. Now, we put the gun storage scenario under the microscope in a separate study. And in this separate study, we used kind of a different process, and we controlled for some different variables. And when we added the variable of the likelihood of asking about gun storage in a biopsychosocial assessment, we found that suddenly political ideology didn't matter really in any statistically significant way. What's actually more predictive is whether counselors even ask about gun storage. That's really a greater predictor of whether they're going to intervene at a greater level in the clinical vignette. But we also found that perceived seriousness of firearms in the house, the perceived level of importance of religion in one's life, and male gender were predictive. So what this study shows is it's not really about politics. It's really more about what do you think is important to ask about? How serious do you think something is? How important is religion to you? And are you male or female? Do you identify as being male or female? So you can see some kind of confusing and contradictory results here. Now this brings us to a polling question. What percentage of graduate counseling students do you think are male? So what's pretty clear is you're all saying it's got to be between 10 and 40%, but your most popular answer so far is 30%. Some folks are saying only 10%. So you're all thinking it's a minority of counseling students. Well, there is a study that was conducted that's related to this question. But before we get to it, there's some evidence that Republican students who are registered with the Republican Party, in other words, in college settings, they are reluctant to speak in class. They tend to be quiet and to participate less in classroom discussion than their Democratic peers. Now, when interviewed, even anonymously, about why that is, the most glaring thing that these students say is, well, I know that my professors are different than me politically. And I think that my professors and my classmates who are more liberal than I am, if I tell them what I think and feel, they're going to mischaracterize me and judge me negatively as being some kind of, hateful person or something that I'm not. And I don't want to deal with that. And I certainly don't want to get graded poorly because my professor is biased against me because of my political beliefs. So I'm going to lay low and just skate through and not tell people what I think and feel, which can be a huge problem in the mental health professions when a big part of what you're doing in your graduate experience is exploring your worldview and your beliefs about things and deeply questioning how your worldview, including political ideology, religiosity, spirituality, etc., philosophy of life, morality, and ethics, how these things impact the work that you do. Perhaps we are failing at providing environments in universities where students feel safe to be able to truly, openly, and genuinely talk about their thoughts and feelings in an appropriate way in class. Now, a very large team of social psychologists conducted multiple studies and then created a position paper, more or less. They said that since the 1950s, and if you go back to the 1950s, you find that social psychologists were very politically diverse. They were just as likely to be politically conservative as they were politically liberal back in the 1950s. Since then, with each decade, incrementally, the research would suggest the social psychologists have become less and less conservative and more liberal, or better put, conservatives are less likely to enter into social psychology, and increasingly it's being dominated by people who identify themselves as politically liberal, to the point where now it's less than 10% of social psychologists identify as being politically conservative. They made a very compelling case based on their research that this is not to the benefit of the field, because they were able to show that as the profession became more and more politically liberal, the research questions being explored fit a liberal narrative and were pejorative or judgmental towards conservatives over time. And if the goal of social psychology is to better understand people within societies and how they interact with each other socially, then perhaps we're only getting part of the perspective on that because of the political makeup or the lack of political diversity of the researchers themselves. Now, you can read their paper to find out how they built that compelling case, but it's an interesting perspective. And it raises the question of, Well, could the same be true for, say, like counselors and marriage and family therapists and clinical and counseling psychologists and forensic evaluators, for example? Now, Evans in 2013 analyzed articles published in major counseling magazines and journals from 1981 through 2011. What she found is that as the percentage of counselors who were male decreased over time, and it did dramatically over time, the number of articles published about men's mental health issues declined along with it, to the point where almost never were any articles ever being published about men's mental health issues. This is particularly interesting given that when we look at mental health disparities in terms of outcomes, we see that men are particularly sort of gifted, if you will, at having problems related to mental health and needing appropriate care, and oftentimes much less likely to access it compared to their female counterparts. Now, Evans said this is a problem, but was very surprised to find that when she started telling her colleagues about this problem in counselor educator venues, she would get responses from researchers like, well, I mean, men have had their time. We've done plenty of focus on men in the past. We don't need to anymore. Or why should we even research the differences between men and women in terms of mental health treatment needs? Why is that even a relevant question? Or, well, we need to, think about all people, not just men. In other words, she was surprised to find that almost nobody seemed to care or to think that this was problematic in some way. So, in other words, opening the door for could there be research bias that we're not even aware of? Now, these are CACREP accredited clinical mental health counseling programs. This was back in 2018. What we found is that among full-time faculty, 38% were male. And among the students themselves, 17.39% were male. Today, in 2022, it's down to about 10% of graduate level counseling students are male. Now, maybe that's good, maybe that's bad, maybe that's neither, maybe that's both, but it raises some interesting questions. That if the makeup of both the clinicians and the researchers and educators is not representative of the US population, whether in terms of race and ethnicity, because look at some of these other numbers, race and ethnicity. I mean, we're not doing very well with being representative of the overall US population with some various races and ethnicities. So if we are not representative of the US population, then is it possible that without us being aware of it, bias will leak in to the work that we do, both in terms of research, in terms of providing instruction for counselors and training, and in terms of the work that we do in sessions with our clients. All right, now there's the research implication. We kind of already talked about some of the responses that Evans would get when her research was published on the relationship between the gender of counselor educators over time and the number of articles that focus on men's mental health issues. I just saw there was an editorial in, I think it was Medscape Psychiatry. It's from a psychologist. And they were defending that the APA has a special guideline about men's mental health issues. Apparently, a lot of people said it's sexist that they have a specialty guideline for working with men, and it's maybe misogynistic. Their whole point is that there are constructs like male toxicity that need to be understood and researched and addressed. And turning a blind eye to these things is not in the best interest of clients or of professionals. It's kind of the opposite of misogyny, their intention, in other words, in publishing those guidelines. So if the scarcity of men in the counseling profession translates into a scarcity of research on men's issues, does the scarcity of conservative researchers and professors in counselor education correlate with a scarcity of research on conservative issues, creating a narrative that only gives us part of the picture? That's the question. Now, the next area of potential implication is about professional advocacy. The Affordable Care Act was passed, And then the American Counseling Association put out a document entitled The Affordable Care Act, What Counselors Should Know. What is very interesting about this document is it only tells you good things about the Affordable Care Act. This was interesting because at the same time, people within the mental health professions were publishing articles about some of the drawbacks of the Affordable Care Act, the negative ways it would affect mental health care for clients. Now, you could argue that the net benefits are much greater than the net drawbacks. But when the ACA published a very one-sided document, it raises a great question. Do they have their blinders on? Because one of the drawbacks in the professional literature at the time was that many clients would lose their policies or their rates would increase. The ACA only talked about the people who would get reduced costs for insurance. They didn't talk about how it would set other people's rates much higher. They left that part out, along with every other potential drawback for that legislation. Raising questions on why. If it's really what we should know, shouldn't they tell us about the benefits and the drawbacks about a particular piece of legislation? Wouldn't that be objective in some way? Now, I'm, by the way, one of those counselors. So what happened is I joined the ACA. I then went into private practice. I was delighted to find that through the ACA, I could purchase a health insurance plan for $89 a month that was actually a good health insurance plan. $89 a month, self-employed. It was wonderful. But then the Affordable Care Act got passed, and my premium went from $89 a month to over $350 a month. That's a huge increase for a very young counselor who had just gone into private practice and was building a caseload. And when I contacted the insurance company and asked them about it, they said, well, your plan is now illegal. So we had to add things that the Affordable Care Act permits, like maternity care. And I'm like, but I can't have children. And they were like, doesn't matter. And also emergency dental care for your imaginary children, which I didn't have, and a bunch of other things that the Affordable Care Act required be added to the policy. So I could get the $350 a month plan, and then every year thereafter, my insurance rate skyrocketed to the point of like $900 a month within a relatively small number of years, from $89 a month. So it's ironic that my ACA insurance plan got illegalized by the Affordable Care Act, but the ACA couldn't even tell us that that would happen in their document on what we should know. But it happened to a lot of my clients too. A lot of clients found they could no longer afford insurance, or that there were some negative effects of the legislation. In fact, that got PolitiFact's Lie of the Year, that if you like your plan, you can keep it, became the political lie of the year in media research outlets. So the point here is there bias even among our own associations in terms of informing us objectively about benefits and drawbacks? Now, I do also want to say something really good that happened with the Affordable Care Act was I started seeing a lot of clients who only work part-time and were very underemployed, got free insurance plans and really good plans and could access therapy so much better than they could before this act. So please understand, my point here is not Affordable Care Act is bad and the ACA screwed up by endorsing it. What I'm saying is the Affordable Care Act is good and bad. There are good and bad things about it. And the ACA, if they're going to tell us this is what we ought to know, they should tell us about everything that we ought to know and not only the good things about a piece of legislation unless they are politically biased. Similarly, the executive director of the American Mental Health Counselors Association published an article entitled Independence Thanks to Obamacare, supporting legislation identifying that the provision of health insurance and health care through consistent coverage should be essential to an authentic realization of the American values of independence, fairness, and opportunity. But again, no drawbacks in the legislation were noted. And because private practitioners were particularly affected and the majority of their members are private practitioners, you would think that they would at least tell us about some of this stuff if they were trying to be objective. Now, this can also matter a great deal in terms of political advocacy. So what you see here are photos of me and different counselors meeting with various legislators. on both the state and national level. In the state of Florida, the only way that you get a bill passed as a Mental Health Counselors Association is by getting Republican legislators to write the bill and support it, because our legislative branch is dominated by Republicans. So you have to do a good job of influencing conservative legislators. But if conservative legislators look at what your association puts out and they see clear and obvious bias, like some of the stuff I was just describing to you, then how likely are they going to be to feel good about authoring a bill on your behalf? Are they going to experience you as an enemy instead of either A, an impartial and objective resource that politicians in any political party can use, or B, an ally even for that matter? So if you do not understand conservatives, if you have prejudicial and inaccurate beliefs about what the average conservative thinks or feels, which seems to be the case, as we'll find in upcoming slides, and if you can't speak in their language, and if you're putting out things that are very biased politically, then you lose your political capital. We have to find ways to be able to appeal to all political ideologies and parties to best advocate for the profession. And time we've demonstrated that. The Counseling Compact was a great example of that, by the way. When we went to Tallahassee and we met with legislators, the only resistance that we got was surprisingly from Democratic legislators. And for them, they framed the Counseling Compact as deregulation. And in their minds, deregulation equals conservative, ergo, I should oppose this. So we had to figure out, because the Republicans were already sold on the Counseling Compact, we had to figure out how to now construct an argument that would work well for liberal legislators. And in fact, I think we did a great job with that, because when it came to an actual vote, unanimous support from both Republicans and Democrats, not a single oppositional vote, not only for this bill, but for the previous bill that we did to make it easier to get licensed in the state of Florida. Unanimous support from Republicans and Democrats, because we know how to speak to both. We know how to appeal to both, and we know how to not be prejudicial and hyper-judgmental about political ideologies and parties. We understand and can find the overlap in perspective between different groups. Now, next, a lot of you are forensic evaluators. We are the National Board of Forensic Evaluators. What about bias among forensic evaluators? Let's start with what our codes of ethics say about forensic evaluation. We know that what makes forensic evaluation different than clinical or therapeutic evaluation is that our primary ethical prerogative in the forensic evaluation realm is objectivity, more so than the clinical or therapeutic realm. In fact, in the forensic evaluation realm, we are not here to advocate or help a client. That is the opposite of your intention when you're providing clinical work or therapeutic work. Your goal in the therapeutic arena is to help somebody. In fact, the 2020 task force defines the counseling profession as a helping relationship designed to empower diverse individuals, families, and groups to accomplish their goals. That is not what you're doing in forensic evaluation. In forensic evaluation, your only client really is the truth. It is for you to use a fair, ethical, and objective process to answer as honestly as you can and as objectively as you can with as little bias as possible serious psycholegal questions posed by various legal entities. That is what your role is in the forensic arena. And we see that highlighted in the ACA code. We see it in the OMCA code of ethics. We see it in the AAMFT code of ethics. And we see it certainly in the APA specialty guidelines for forensic psychology. We are to be unbiased, impartial. We're supposed to be aware of our biases and to take appropriate measures to prevent them from leaking into the work that we do. Now, here's how this becomes very interesting. Because sometimes a person will tell me, hey, Aaron, I know you do those trainings for MBFE. I'm going to go to one. I want to get certified as an evaluator. I want to do immigration evaluations because I want to advocate for oppressed individuals who have come to this country and are now at risk of being tossed out of the country. That's horrible. It's unfair, and it needs to stop. All right, let me pause here and say, those are admirable positions. We need advocates in the forensic arena. We need advocates in general in the country. Nothing wrong with the perspective that I just described to you, except one thing. That's not why you become a forensic evaluator, and that's not your role as a forensic evaluator. It's not to advocate for the oppressed. That's advocacy work, and that's not part of the scope of what a forensic evaluator does. A forensic evaluator is not, in fact, ethically obligated to not advocate. They are ethically obligated instead to objectively and without bias, using the data available to them, answer certain questions posed by the court without investment in the ultimate outcome. I know that's easier said than done, but that is what we are tasked with doing in the forensic evaluation realm. And because of that, it is so essential that we use many different sources of information beyond the client's self-report. We have to interview collaterals, a variety of collaterals. We have to review records. We have to use tests that are designed to pick up on signs of invalid responses. Now, is there evidence that forensic evaluators are biased? Well, let's do a magical journey through the research on, or at least some studies on evaluator bias for forensic evaluation. This study was the first one that got me really interested in this one. Social workers, 3.5 times as likely as psychologists to find defendants incompetent in competency evaluations, and 5.5 times more likely as psychiatrists to find defendants incompetent. Why? Well, we don't really know for sure why. This study could not tell us why, couldn't answer that question. But there were many different possibilities explored. One of those possibilities is the difference in professional identity between these three groups and in how they are trained. Social workers, compared to all the other mental professions, get trained more in advocacy and in social justice advocacy. So they are also more likely to view problems as being systemic and not individual. For example, I think it's kind of a humorous example. I was attending a training about tobacco cessation counseling, and a question was posed. The question was, the presenter was telling us about research that showed that tobacco companies targeted low-income neighborhoods for advertising. Question is, why do they do it? I stopped and turned to my colleague and said, you know what's going to determine what this person says is the reason why? It's what their professional identity is. If they're a social worker, they're going to blame this on some kind of systemic cause. It's going to be about policy, some kind of law issue, or it's going to be about evil corporations and their greed trying to get profits. If they're a psychologist or a counselor, they'll be a little bit more likely to look at individual constructs. They may, for example, look at some research about, are there certain neighborhoods where people are going to be more likely to want to be self-medicating, or who are going to be more likely to make impulsive decisions that maybe helped to increase the probability that they would end up living in that neighborhood to begin with. And there actually is compelling research about that, even some neuropsychological research about the prefrontal cortex and the likelihood that one will be susceptible to purchasing cigarettes. But anyway, because it was a social worker, sure enough, she said, well, it's because tobacco companies are greedy and they want to get money. But my question is, why do they think they can get more money from people who have less money? Because they think that they know that people of lower socioeconomic status are more likely to develop addictions to cigarettes. If they thought that the wealthy were more susceptible to those addictions, then they would be targeting wealthy neighborhoods, trust me, because again, they're greedy and they want money. So it's not that the social worker is wrong. Of course, tobacco companies are greedy and want money. It's kind of like what companies do a lot of times is they want money. But why do they think they can get more money from the people who have the least money would be the question in that case. And her answer didn't really answer that. At any rate, with competency evaluations, though, one possibility is that a social worker is thinking, if I find this person competent, then they're going to stand for trial and they will probably be convicted and they'll probably go to prison where they won't get the help they need and it will suck. I'd rather them go to a psychiatric hospital and get help. If I find them incompetent, that will be more likely to happen. I think that could be part of what's going on, but I can't tell you that I know that that's true. It's just an interpretive hypothesis. That's all it is. Everson and Sandoval, 2011, 1,106 professionals in the field of child mistreatment. They found 3 factors that correlated to decisions related to whether childhood sexual abuse actually occurred. They found that people who have an emphasis on sensitivity, so they focus on minimizing false negatives, are more likely to believe that the sexual abuse did occur. For those who had an emphasis on specificity, they focused on minimizing false positives or errors of overcalling abuse. They were less likely to believe that sexual abuse had actually occurred in clinical scenarios. And also those who are skeptical about child and adolescent reports in general were less likely to believe that childhood sexual abuse occurred in certain scenarios. So certainly we have beliefs that can impact the probability of our belief, even though we're getting the same data that the next person is getting of whether or not something actually occurred. Richards identified in the research on neuropsychological evaluation, forensic evaluation, by the way, 12 different sources of bias. Role bias. This is when people who got trained to do clinical work have a hard time switching their role to being a forensic examiner. They don't realize that their role is not to help a person anymore. The second is a financial and payment bias. That is, am I getting paid and who is paying me? Which brings us to referral source bias. Neuropsychologists are more likely to raise conclusions that favor the attorney who hired them. That is disappointing, because if we were truly unbiased, then there would be no difference in terms of how often we side with the opposing attorney. Well, it's not even siding with an attorney. We don't do that. But how often our conclusions favor one side or the other, there wouldn't really be much of a relationship in theory anyway. Self-report bias. And this is when forensic evaluators will rely too much on what the client tells them instead of looking for collaborative data. Another area of bias was underutilizing base rates. They don't know how prevalent malingering is. They found that a lot of forensic evaluators underestimate the percentage of the population in a certain context that will be malingering. Ignoring normal variance in test scores. If you give a client 10 tests for the same thing and 2 tests give you a positive and 8 don't, then people tend to think, oh, because those 2 tests gave me a positive, that's the way I should go. Forgetting that by sheer probability, you expect variance in outcomes. Confirmation bias. This is, I already developed a hypothesis early on, and I'm more likely to see the evidence supporting it than the evidence contradicting it. Personal and political bias. What do I believe personally about an issue? What do I believe politically about it? Group attribution area. We develop an overly rigid expectation about the ways people with certain illnesses should behave or perform on certain tests. Diagnosis momentum, the tendency for an opinion or a working diagnosis to become almost certain as it is passed from person to person. And the good old days bias, the tendency to view oneself as healthier or higher functioning in the past, or to underestimate symptoms prior to an injury. And finally, overconfidence, the accuracy or precision of one's diagnostic capabilities. We get overly confident and think that we can do more than reasonably we can do. So another study, 2017, looked at how come there's so much disagreement among forensic evaluators? And they found 5 different factors that seem to be supported in the research, including how difficult the task is, limited training and certification. Oh, believe me, we are tuned to that at MBFE. There are only about 300 certified forensic psychologists in the whole country, even though they've been around since 1972, I think. And there are only about 200 certified forensic mental health evaluators in the country, even though we've been around since 2003. That's 500 certified forensic evaluators in the entire country. That tells you that there is a shortage of people who've gotten specialized training and certification on how to conduct forensic evaluations. The use of unstandardized methods, individual evaluator differences, how we are different as evaluators from each other, and then finally, adversarial allegiance. I got hired by the defense attorney. I'm kind of biased towards the defense's case. You see how some of these themes keep popping up over and over again in the research. Zappala and other researchers in 2017 identified evidence of a blind spot among forensic evaluators. In other words, if you ask forensic evaluators how biased their colleagues are, they'll give you a much higher number than how biased they think they are as an individual, which is impossible. You can't have everybody individually saying, I'm not biased, and everybody else is. There's obviously evidence of a blind spot in that sense. And then we have our some question about, is empathy an ally or an enemy in forensic evaluation? So Moulet and others argued opposition to death penalty may sway an evaluator towards data that supports, and minorities may more likely to be found incompetent than white defendants. But they also said that empathy may facilitate client disclosure. If you can empathize more with a client during a forensic interview, then will that be evidenced in the way that you interact with them? And will the client feel more comfortable telling you more of the truth? And then will you get more objective information from the client? That is the question. Zapf and other researchers, evaluators who had received training about bias were more likely to acknowledge cognitive bias as a cause for concern, and evaluators with more experience were less likely to acknowledge cognitive bias as a cause for concern. So this is evidence that it actually helps for evaluators to get training about bias. 58% of forensic evaluators reported receiving training on cognitive bias, which means 42% did not. Goen, Smith, and other researchers identified external bias, who hires the evaluator, and internal bias, evaluator agreeability. This is how agreeable is the person doing the evaluation, the use of expressive empathy techniques, and the defendant's race or ethnicity could factor into internal bias within the forensic evaluator. Kahn and other researchers found systematic individual differences in evaluator decision-making about sexual violence that cannot be accounted for by differences in the underlying case, suggesting that evaluator assignment is a significant factor in determining the report conclusions for sexual violence potential evaluations. So there's obviously something going on within the individual evaluator, separate from the facts of the case, that makes a difference in terms of our conclusions. Mo 2022, forensic evaluators who score higher in traditionalism are more likely to opine that a defendant meets not guilty by reason of insanity standards. So what we've found is ethically, forensic evaluators are obligated to be particularly objective, especially compared to people who are working with clients in a therapeutic or clinical context. Yet there is evidence that A, we still have biases that affect our work, and B, we are to some degree blind about those biases. So now comes the question, how do we compensate for this political bias? Well, in the research, here are some examples of strategies that were raised. We have to become increasingly aware of our own biases and we have to conduct comprehensive evaluations. The more sources of data, in theory, the more objective you can be, and the more accurate your conclusions will be. We should increase evaluators' use of standardized forensic methods, like forensic instruments, checklists, and practice guidelines. We should think very carefully and intentionally and deeply about our own biases. We should be aware of the reality of bias, and that should be a significant focus of our training, and the boundaries that should be maintained in a balanced way. We should monitor our reactions to defendants, internally and externally, and we should use, and you keep seeing this over and over again, multiple sources of data. A case has been made that we should record our interviews, because in recording interviews, you can play them back. You could consult or get supervision, and you could demonstrate or become aware of the way that your bias is impacting the way that you interact with a client. It's amazing sometimes when we watch what we did in an interview that we become aware of things that we weren't aware of at the time that we did the interview. We need training on cognitive bias. We should acknowledge and be aware of our biases, recuse ourselves from certain cases where we can't be as objective. We should track our opinions across a variety of variables. And like other researchers have concluded, Acklin and Velasquez say we should use checklists to outline and standardize procedures, structure our data collection, use reliable retrospective clinical diagnosis at the time of the offense, structure data aggregation, and there should be a linkage between clinical, functional, legal elements and post hoc hypothesis testing of case data. We're going to talk more about post hoc hypothesis testing in a moment. Bias reduction strategies from social psychology, such as using structured assessment methods, relying on a small number of dimensions, developing checklists. Do you see here the same strategies keep coming up over and over again in the literature? Except for this one, there's an app. I have not checked it out yet, I have to admit, but it's called the Case Rate app. It is an app that helps forensic evaluators to become aware of signs of bias in their conclusions and outcomes. And it is free from what I read in Goen Smith's article. And race and gender bias in diagnosis can be reduced by expanding the use of mental health screening, self-report measures, including some psychological tests, structured interviews, and statistical prediction rules. So you're seeing some of the same strategies come up over and over again when we walk through the clinical research, and it all highlights something that we here at NBFE have been saying for a very long time. That when you're conducting a forensic evaluation, you should draw upon 4 categories of data in a very thorough way. And only one of those is clinical interview. You should be pulling records and reviewing them thoroughly and looking for evidence of answers to the questions you're supposed to answer in the evaluation, without a blind spot for the evidence that contradicts a hypothesis you have developed. Sometimes what I'll actually do on an iffy case is I'll bullet point all the evidence for something and all the evidence against it, which we'll get to in a minute, based on the data I collected. Collateral information, so interviewing a number of other people who can have helpful information, so often makes a difference in terms of the way the picture starts to look as time unfolds. And then using objective testing data, normed, valid, reliable, and reputable tests. Here's a quote from a research psychology textbook. The logic of statistical testing is largely a reflection on the skepticism and empiricism that are crucial to the scientific method. When conducting a statistical test to aid in the interpretation of a set of experimental findings, researchers begin by assuming that the null hypothesis is true. That is, they begin by assuming that their own predictions are wrong. So what I'm saying is identify all of the possible explanations for phenomena and then intentionally develop the best case that you can based on the data that you collected for each of those possible explanations. Maybe even do that in writing. And then this can help to compensate for some of the blind spots that we have in forensic evaluation. And as it stands, this is a strategy that has been used for at least 2,000 years. Ancient Stoic philosophers, for example, would use this strategy, as have a number of philosophers in ancient times. Okay, so let's pause here for a moment. I'm just going to look at the chat box and the Q&A box, and I'm going to see if there are any questions about the content covered so far. So our first anonymous attendee has asked, how do you avoid this? And that was at 3:23, so that was probably about 10 minutes ago. That was probably before we went into the strategies about how you avoid this. So hopefully we have already answered that question. Oh, but then they added the payment bias thing. So here's what I would say. The process I just outlined you will help to compensate for the payment bias. If you start by examining, like I'll give you an example. I did an evaluation recently, and the allegations were that parent A has a personality disorder and is not getting adequate treatment for that personality disorder. Okay, so that's what one side was alleging. The side that paid me for the evaluation was arguing that parent B did not have a personality disorder and was getting adequate therapy. Okay, so I looked for the evidence that in the case, based on transcripts and an interview from the referral source and that sort of thing, what are both sides alleging and why are they saying it's true? And then what I did was I said, okay, one possibility is that this client has a pathology that is yet to be diagnosed and or has not been treated. Another possibility is that the client does not have any pathology. Another one is they have pathology, but it's something they've already been diagnosed with and are already getting appropriate care for, et cetera. So I wrote down all these possible explanations. Now, as I began to examine testing data, clinical interview, structured clinical interview, and also records reviews from therapists and who have worked with the parents and otherwise, I wrote down all the symptoms that were popping up. And then I said, okay, what possible diagnoses match these possible symptoms? And I came up with all the possibilities I could. And I actually used things like the DSM-5 differential diagnosis app and that sort of thing to help I identify when you have all these overlapping symptoms. Okay, then I said, all right, what is the best case that I can come up with based on all the data I've collected that this client has a personality disorder that has not been diagnosed? And I wrote down everything I could come up with, like as though I was an attorney arguing that this person has a personality disorder and they're not getting adequate care for it. Wrote it all down, all the evidence I could. Did the same for all the other alternative hypotheses. And it became clear and glaring to me that the greatest amount of evidence seemed to gather under one particular conclusion. Now, I did that process trying to forget entirely about who paid me for the evaluation. Does this guarantee that I had zero bias? No, it didn't. But it reduced the likelihood that I was being biased based on the referral source. I will also tell you that the referral source asked me to attest to things that I refused to attest to because I explained to them, I do not have appropriate data to support that. So I'm certainly not going to be testifying to that. And they wanted me to testify to some things that I just couldn't do based on the data. Even though my overall conclusion was favorable to the defense in that case, there were some key things they were hoping I'd be able to say in court that I just could not say because of the data. And I think that's usually a good sign when I'm saying no to who paid me because and citing that the data doesn't support what they're saying. So hopefully that helps to answer that question. And then the next question, this is always in the back of your head because, or maybe they're asking, is this always in the back of your head because they paid you? I think it is. For me, it's always in the back of my head who paid me. In part because I'm trying to make sure that I don't intentionally have a blind spot, or I don't have a blind spot because of who hired me. And B, I don't overcompensate by ignoring the evidence or minimizing the evidence supporting the referral source as well. Because I'm trying to make sure I'm not doing either one. And so I think it's good to have that intentionally in your head, actually, who paid you, but for a different reason than some people might have it in their head. Okay, I believe we have answered all the questions in the Q&A box. We have an hour and 15 minutes, I think, left. Perfect. So I think we're going to have a good amount of time to be able to do a couple exercises also. I want to introduce you to political dysphoria, what it is and how to address it. This will have more utilization in the clinical or therapeutic arena than in the forensic arena, but it can also be applicable in the forensic arena. Remember, we try to make these webinars so that because we know that most of the people who get certified by us are both working in clinical or therapeutic context and in forensic context. We try to appeal to both. So here's a polling question for you. When do political beliefs and values affect your work? Sometimes, okay. Wonder if we can also get some maybe specifics about when it might affect somebody's work. All the time, all right? Probably always in some way or other. Could you maybe send in some examples of how or when political beliefs or values can affect your work? When the client's stubborn, that's a good one. Sometimes. I can tell you a couple of mine. When I lose focus evaluation, that's a good one. I've had to work with clients who are prejudicial or even racist. I can feel just cringing sensation in the pit of my stomach when I work with them, and yet somehow I still have to be helpful and hold them in positive regard. When my client's strongly affected by them, resistant clients just before or after an election, that's a good one that we're about to focus on. When the client is disrespectful or I feel unsafe, when they interfere with another's life, violence, and I lose sleep, the nature of their crime or abuse, that's a good one. Probably to some degree, I try to avoid political topics due to the location of my practice. I have found I cannot avoid political topics in therapy appointments with the clients that I have for therapy. It's not going to happen. I just can't. I'll come back to that in a few minutes. When their symptoms cause them to be hyper-focused on politics, yes. You ever work with clients with like delusional disorder, for example, and their delusions are very politicized in nature? That's a tough one. Talk about, going down the rabbit hole sometimes. Now, other times we ask this question, sometimes people also talk about when laws are passed by politicians that have an effect on the work that I do. That's another scenario when political beliefs and values can affect your work. When local politics are impacting my clients. Yes, I've had lots of clients come in with serious concerns about local politics as a subject of focus in our sessions. Okay, so good. We got some answers to this question. Here's the term political dysphoria. I thought that I invented this term because when I first wrote about it and had it published, I could not find any evidence that the term had ever been used anywhere online. And all I did was take the word political and the word dysphoria and smush them together. And when I combine those two terms, it seems to me that a definition would be a state of feeling very unhappy, uneasy, or dissatisfied about party politics. I am pretty politically dysphoric myself. Maybe a lot of you can relate, especially anytime there's an election coming up and you're getting swarmed with insultingly ridiculous ads that make everyone look evil except for the person who the ad is supporting, and it's almost insulting to one's intellect to see some of these ads, it seems like, but that's the term. I was wrong. Somebody used this term before me in 2013, just before I thought I created it. And it was in March. It was in a post from an attorney who used the term to describe a disease that induces a terminal case of finding political realities hard to bear. Pretty close to my definition for the term. So I will give props to the attorney, David Rubin, who I have borrowed this term from without knowing it. Before we go any further, I want to give you maybe like 7 minutes to do a very quick moral foundations questionnaire. Now, to do this questionnaire, you are going to have to use a link, which I'm going to put in the chat box. First thing I want to tell you about this is when you go to this link, you will see a space to put your name. Feel free to leave that blank. Just don't fill out your name and it will be anonymous. Now, the only person who has access to this is me. So if you don't care about me knowing your name, that's fine, but just leave the name blank and then answer the other questions. That's the first thing. The second thing is at the end, you're going to get different scores for different terms. It will project on your screen at the very end. And it's going to do it before you hit submit, I think. At the very bottom, above the submit button, I think is when you'll see those scores. Notice which score was the highest for you and write it down, because there will be a polling question about it. One more thing I'll say while you all are working on this questionnaire. You can screenshot or print up your results before you hit submit in case you're going to be interested in your other values also. But just make sure that you remember the score that is the highest. And I'm going to tell you about some of the constructs behind the questionnaire that you just completed. As we go through some of these tips for countering political dysphoria. So the first tip is to reframe political differences as political diversity. That's all that it is. It's diversity. And generally speaking, mental health professionals seem to value diversity. But diversity isn't just for certain areas of human existence. But if we're interested in all of humanity and what humanity has to offer, you'd think we'd also think that political diversity could be a good thing. That could actually be a very good thing in some ways. And in fact, there is some evidence to suggest that it is good to have a politically diverse population. Now, one model that can be used to help us to better appreciate and understand political diversity, but also, remember I brought up before that when we're advocating for legislation as part of the associations in the mental health professions, we have to learn how to appeal or how to speak in the language of people with different political ideologies. In the sense that there is a relationship between moral foundations and political ideologies, it can be very helpful to figure out how the ideology of the person across from you, whether that person is a politician or a legislator, whether they are a client in a therapy room with you, whether they are a colleague who you are talking with, but whoever that, or whether it's a relative across from you at Thanksgiving dinner, but whoever this person is, the art and science of trying to figure out which moral foundations they are truly emphasizing when they express any political belief. It's a very helpful and powerful tool, and a tool that's less prejudicial in terms of examining differences in political ideologies, or for that matter, religious and spiritual beliefs, and other differences in morality and ethics. In this model, which is a fusion of evolutionary psychology, neuropolitical research, social psychology, and anthropology, the idea is that there is evidence that throughout the history of humanity, 6 different moral foundations have naturally arisen that we seem to be biologically hardwired to think of as being important in varying levels. And that each of these 6 moral foundations that seem universal across all of humanity, we see them in every culture, every country, these 6 moral foundations developed because they were to our advantage from an evolutionary perspective. And they help to explain why humanity still exists in our environment. They arose to address, if you will, very specific survival needs that we have as a species. The first foundation is the care-harm foundation. This is about protecting children and sweet little innocent nice animals. It's kind of generalized to, like puppy dogs. And it arose because we needed to, a species cannot last in harsh conditions if the older and stronger members of the species do not have a particular fondness for the younger and less defensible members of that species. In other words, it's kind of like the old saying, God made kids so cute so that their parents wouldn't destroy them when they get angry. It's a little bit like that. But it also applies to the elderly. It applies to individuals who have maybe conditions or disabilities that make it harder for them to do things that other people would find more easy to do. And it also extends to, as I've said, kind of domesticated pets and animals. Over time, it's evolved to be more generalized than only about children. It's triggered by the distress or neediness expressed by one of these individuals who need our help. And the emotion that evolved within human beings that seems to support the Care and Harm Foundation is compassion. And there are relevant virtues of caring and kindness attached to this foundation. The second one is fairness and cheating. Humanity has learned throughout time that if you got a bunch of members of a group that are not being fair and are cheating, then this is probably going to go south and it's not going to work for people. The adaptive challenge is reaping benefits of two-way partnerships. I have to know that if I agree to give you A and you agree to give me B, then we're both going to follow through somehow. It's triggered by cheating, cooperation, and deception, and related emotions are anger, gratitude, and guilt. Virtues are fairness, justice, and trustworthiness. The third foundation is loyalty and betrayal. This developed because of the adaptive challenge of forming cohesive coalitions. Earlier humans could not survive in the harsh conditions they endured without banding together in small groups that were cohesive and that operated somehow together for the benefit of everybody. A trigger is the threat of a challenge to the group, whether from another group or from another species or from nature or whatever the case might be. And key emotions are group pride and rage against traitors. Relevant virtues are loyalty, patriotism, and self-sacrifice. The fourth foundation is authority and subversion. The authority and subversion foundation seems to have developed because, as anybody who's worked with any small group kind of knows, it's pretty hard to get anything done unless you can have an executive figure that's sort of managing and facilitating it, and ultimately having to sometimes throw in a judgment call to steer us in the right direction. The challenge is forging beneficial relationships within hierarchies. It's triggered by signs of dominance and submission, and related emotions are respect and fear. Related virtues are obedience and deference to authority. When students show respect for professors, they are operating from this foundation. And when an association creates a committee and that committee has a chair, they are operating from this dimension. It's hard to get anything done without having some form of authority or hierarchy in any system. The fifth is sanctity and degradation. It arose because of the challenge of avoiding contaminants. I like to say, when you read the Old Testament in the Bible, and you look at all of the different things that were clean and unclean and all the different rituals of cleansing and all that stuff, and the things you couldn't eat and the things you could eat, and the kinds of wool and fabric you could mix together and what you can't, a lot of that developed because they were living in harsh conditions where there were a lot of contaminants and a lot of sickness. And they had to develop an awful lot of rituals to try and reduce the negative effect of those contaminants, to try and keep entire populations from being wiped out by disease. It's triggered by waste products and diseased people, and key emotions are discussed. Related virtues are temperance, chastity, piety, and cleanliness. And then the final, and actually the latest to evolve in the timeline of humanity, is the Liberty and Oppression Foundation. It appears that there's no evidence that this foundation existed until human beings developed the capacity to use tools and language. It evolved to keep dominant individuals in the group in check. In other words, it's kind of like a reaction to when authority and subversion gets a little crazy. Because prior to tools and language, the strongest, most powerful member of a group that could essentially physically take out anyone in that group who's dominating in their mentality would probably become the leader a lot of times. And in doing so, that leader may not be the best leader and might actually be very harsh and unfair, violating the Fairness and Cheating Foundation, or in sometimes even the Loyalty and Betrayal Foundation. And when people have tools and language, they can communicate with each other about this despot, and they can use those tools to compensate for the lack of physical advantage that they have. And they can use language to motivate other people who agree with them to join in with them. So it's a group now going after the despot. So those are the moral foundations. Very multi kind of disciplinary theory of psychology that seems to be very useful. Now, there's a video. If we have time, we'll watch it, but we'll skip it for right now because we may not have time for it, but it's a good video. Let's do a polling question real quick. You took the Moral Foundations questionnaire, right? So which foundation did you have the highest score on? Was it the Harm Care Foundation, the Fairness Reciprocity Foundation, In-Group Loyalty, Authority Respect, or the Purity Sanctity Foundation? All right, it's not surprising to see this. 85% of you scored highest in the Harm Care Foundation. And that makes sense because you are mostly helping professionals. Who gets drawn to helping professions? People who tend to strongly value the Harm and Care Foundation. Now, there are a lot of other occupations that tend to draw people who score higher in a lot of these other moral foundations. But for you all, that was generally the highest foundation. But some of you were really high in fairness and reciprocity and authority and respect as well. Pay attention to that because I'll come up in just a moment. So, come to find out, there is a strong correlation between these moral foundations and people's scores on the questionnaire you just took and their political ideologies. Now, what we see here is that people who identify as conservative have what we call a multi-channel moral value system. People who are liberal tend to believe the conservatives do not care about the Fair Harm Foundation. That is incorrect. In fact, they care about it a little bit more than the other moral foundations, and almost as high as liberals care about it. It's one consistent finding in research is that people who identify as politically liberal, they underestimate the degree to which conservatives care about fairness and protecting innocent people from various forms of harm, and also about providing care for people. Actually, conservatives, as it pans out, value care almost as much as liberals do. The difference is they value everything else a lot too. whether it's fairness, it's authority, in-group loyalty, or purity and sanctity. They tend to think all of the moral foundations are really important. Liberals have what researchers call a two-channel moral foundation system. They emphasize harm and fairness far above these other things. They say, who cares as much about authority and loyalty and purity? Those things aren't that important. This is really what's important. And this allows you to very much challenge some of your beliefs you might have about the other side. For conservatives, sometimes they will underestimate how much liberals care about fairness. Liberals will tend to underestimate by far how much conservatives care about care and harm, when in reality, you both care a lot about it on average. Very important to both groups. There are differences, though, in how fairness is conceptualized. For example, people who tend to identify as liberal politically tend to be more interested in what's called proportionality. So they care more about more about equality versus proportionality. So liberals tend to care about, do we all have the same stuff in the same amount? Conservatives say, do we all have the amount of stuff and the kind of stuff that's proportionate to how much we are investing in the process? So for example, if two people are on a team and one person puts in 60% of the work and the other person 40% of the work, then conservatives say, well, the person at 40% should get 40% of the profit, the person at 60% should get 60% of the profit. Liberals are more likely to say, man, they should both have the same stuff. They worked on the same team. We did what we could. And then another way to conceptualize it is redistributive fairness versus meritocratic fairness. Am I getting what I earned? Am I getting the same thing as others? So they both care a lot about fairness, just kind of different forms of fairness to a degree. This study is what inspired my dissertation. And it was a study with primary care physicians. First of all, there's actually a couple things that this study did, but one of them was they looked at the specialty areas of different physicians and how likely are these physicians to be Republican or Democrats if we pull their records from voter registration offices, which they did in this study. And what they found is the area of specialization for physicians varies substantially depending on their political party. So, for example, people who work in public health or infectious diseases are much more likely to be Democrats, and surgeons are much more likely to be Republicans, and so on. Now, the other thing, though, that this study did was they looked for relationships between the political party registration of physicians and then what measures physicians would take on politicized issues. And they found significant differences between Republican and Democratic physicians for what they would do in clinical vignettes. Remember, in my research, I tried to duplicate what they did for counselors, and I found way less evidence that there was a difference between groups, which we kind of attributed to the idea that in the counseling profession, we're probably better than physicians at controlling for our biases. Our ethical codes make a big deal about it, but the AMA's ethical code actually says that you can refuse to work with a patient because of a value conflict. Our codes say the opposite. Don't know why I put that slide in that spot. It doesn't seem to fit there. This is unfortunately from the previous group, so don't complete this polling question. I forgot to update it to be for today's webinar. But the question is, which group do you think was least accurate in guessing how other political groups reason morally? And we already answered that question. It was liberals. Liberals are less accurate at predicting what conservatives will decide to do in a moral or ethical scenario than the other way around. And what they tend to do is sort of pathologize the way that conservatives reason. So this is what they did. Researchers gave to 2,000 Americans. Oh, by the way, I forgot to tell you something really important. This chart that we saw looks the same in every country. So no matter what country, these foundation questionnaires get administered in, we see that people who identify as conservative have a multi-channel moral foundation system, and liberals have a two-channel system in every country, all throughout Europe, in Africa, in India, in China, various countries where this research has been conducted. And there's a video on a TED Talk video about this that maybe I'll show you later on if we have time to, that gives you more information about that. In the US, though, 2,000 Americans filled out this questionnaire. 1/3 were asked to fill it out for themselves, the way they normally would. 1/3 were asked to fill it out as they think a typical liberal would do. And then another third were asked to fill it out as they think a typical conservative would respond. These were conservatives who were asked to fill it out as a liberal, liberals who were asked to fill it out as a conservative. Moderates and conservatives were pretty accurate in predicting how liberals or conservatives would reason. Liberals were the least accurate, especially those who were very liberal. They tend to pathologize conservatives and then very much predict incorrectly the way that conservatives will reason about certain moral issues. The biggest errors were about care and fairness. They believed erroneously that conservatives do not value care and fairness, when in actuality they value them more than the other foundations and almost as much as liberals do. So what's happening is they're allowing the fact that conservatives talk a lot about the other moral foundations to give them the impression or lead them to a sort of erroneous conclusion that conservatives do not care about care and fairness and harm. So here's a polling question. What strategy do you think can help us to get some relief from political dysphoria? All right, so we get these elections coming, right? And then we hear both sides say hateful, mean, nasty things about each other. Our clients come in and they'll complain about people who have other political ideologies. Our colleagues complain about it a lot. We see it on the news, depending on what news channels we watch. So what strategy can help us get relief? Stop all media, turn off the TV. You can see where we're going to first with this, huh? What else do you think can help us get some relief from political dysphoria? I wish I knew. Well, you're in the right place because that's what we're going to spend the rest of Xanax. We're going to spend the rest of today's webinar on this. Having conversations with each other. Well, that's a good one. In a certain way, anyway. I've recommended taking media breaks for mental health. Yeah, a media break is different than just turning off media. Look for common ground. That's a great one. That's a great one. Somebody help me. Stop the calls, the signs, and the hateful ads. Respect. Okay, so you're thinking about this. We got some ideas from you all. Our second tip is you can empower clients and yourselves when you feel frustrated at what the other side is doing politically. Instead of spending your time complaining about things beyond your control, you shift your focus to what is within your control. This is an age-old, wise belief that you see across many religions and philosophies. That when we see stuff we don't like, instead of complaining about it, we shift our focus to what we can do that is meaningful and valuable. There are lots of examples of how people do this politically. They do it by voting. They do it by participating in, I say, peaceful protests, because those are the kinds that I like, but they volunteer for a political party. I've had several clients that when they didn't like what was happening, they decided to get more active in their political party. Sometimes that ended up being a really good thing for them and sometimes not. But if they do it the right way, then it can help them to reduce their political dysphoria. Dialogue with others about what they believe and why, and do it non-judgmentally. That is extremely important, and we'll come back to it. Donate to a cause you believe in. Lead by example instead of by complaints and accusations of wrongdoing. Share resources with other people. Write about your positions and principles, and maybe even run for political office. So in other words, I'm not telling you, you know what, we're all thinking morally. We're all in this trying to do the right thing, no matter what we believe politically. So just never take a stand for anything. I'm not saying that. But I'm saying instead of complaining and criticizing the other side, taking action and leading by example tends to reduce political dysphoria on average. Now, another thing that could be done in terms of the bias in our political associations is to adopt processes that reduce the negative effect of bias. This is the Florida Mental Health Counselors Association's Government Relations Committee procedure, which we wrote and the board voted to adopt in December 2019. Prior to this point, a committee could decide, oh, somebody asked us to do something politically and we like it, so we're going to do it, and then do it very quickly. And that could be a big problem if they haven't seriously researched the thing or thought it through first. I remember going to an annual conference and our lobbyist was telling us about the open carry law. And I raised my question and I asked, this is really interesting, but I'm curious, what does this legislation have to do with mental health counselors or with our profession for that matter? And she was kind of stumped and said, well, I just thought it might be a good thing for you guys to know. Now, the reason I asked that question was because I noticed that a lot of things were being talked about that were politicized issues, and they were being talked about sort of through the lens of liberal political ideology as though they're bad things. But I couldn't draw the connection to our mission and purpose as an association, and therefore did not know why we were focusing on those issues. And a lobbyist is awesome, a great person. So please don't get me wrong. I think it's really cool that we have lobbyists who know so much about some of these laws, and maybe the open carry law could have a lot to do with our profession. But we should be able to answer that question, shouldn't we? So we wrote this procedure. And it says, if somebody asks our association to take political action, then we direct that request to our Government Relations Committee, called the GRC. Then that GRC researches the request. And then they create a report. The report includes a summary of what that political action is, what it does, the potential benefits of supporting it, the potential drawbacks of supporting it, any concerns about it that the committee has, any relationship with our code of ethics, and they consult with the ethics committee as part of that process, and an opinion on how supporting it relates to our mission and purpose as an association. The committee is encouraged to consult with our lobbyist when conducting this analysis. Then they coordinate with the administrative staff to survey our members and ask them what they think about this political action and what they'd like us to do or not do. Because we were getting criticized for taking action that members never even got to comment on. Then we forward our report and our final recommendation to the board of directors, and they review and debate and ask questions if they need to, and then they vote on whether to support our recommendation or not. And then we take the action. This is a process that was intentionally created to reduce the probability that we would prematurely and in a moment or a fit of passion take action on something that gets us in hot water, makes us look very biased, or where we take action without having seriously considered or researched the issue thoroughly to know whether we really ought to be taking this position or not. Third tip, engage in healthy political dialogue. Those of you who are marriage and family therapists have an upper hand on this one, because you're used to teaching couples and families how to communicate about difficult issues and still be respectful of each other. So if you are the listener, your job is to temporarily suspend your own perspective. You can do this by asking open-ended questions like, well, what do you want to be different? What are you concerned about? What about this is troubling you? Why is this issue important to you? You can summarize your understanding of the other person's perspective and ask if you have it right. This is called summarizing or mirroring for some people. If they tell you that you don't have it right, then they'll talk some more, and then you try to modify your summary until they think you've got it right. This proves to the other person, not only did you listen, hopefully non-judgmentally, but you also demonstrated an understanding of their perspective. We don't do this at the Thanksgiving dinner table. We don't do this when we're debating politically with people. Some counselors do not do this in sessions with their own clients very well. But this is what we ought to do when somebody is describing a frustration about a political issue. Then we validate anything or everything that we can, honestly and genuinely validate about their perspective. Here, look for the underlying moral foundation. Look for the good in their perspective. Let me give you an example of this. A graduate student in a counseling program said, I think there ought to be a wall on the border between the US and Mexico. This triggered a reaction of some students and even a couple professors saying, how xenophobic of this student. Interesting thing, the student was Hispanic. The student's families were immigrants coming from another country to the United States. The student, when she described her reasoning, said, look, we came here legally, and it took so much sacrifice. It was so hard to do, and it seems unfair that some people come legally and get the same benefit without having invested so much and made so many sacrifices. That's a fairness moral foundation. Number two, she said, we were escaping violent and harsh conditions because of the cartels. Women, and especially adolescent girls and young adult women, disappear all the time, and we know what's happening to them. We know who's behind it, but the police don't do anything about it because they're corrupt or because they can't in some cases, because they're not powerful enough to do it. We escaped that to come here. We don't want it to be easy for those people to come here. On the border towns on the other side of the US, sometimes there still is cartel violence. So that sounds like safety. That sounds like care and harm foundations. Does it sound like xenophobia? No, not really. But people make assumptions that if a person believes in a certain political action, then surely it's because they're evil. But if you examine their perspective non-judgmentally, you will inevitably find admirable moral foundations. Unless it's a pure psychopath or something that you're dealing with, then you're going to find some very admirable moral foundations that you can actually empathize with and validate. So examples might be, I really like that you're concerned about whether or not this legislation is fair. I have the same concern, even though I disagree with you on it. I can see that you really care about others' suffering, and I admire your compassion. After validating, you introduce your own perspective using I language. Hey, I feel this way. I think this way. I'm concerned about this. I believe this. I'd rather it be done this way. That sounds very different than some of the very preachy things that people say in response when they're describing their perspective. You try to keep the dialogue respectful, monitor your tone of voice, avoid interrupting. You adopt the mentality of a curious explorer, an anthropologist who has uncovered a new society and wants to learn all about how these people think and feel. If you notice yourself getting upset, you acknowledge that you're too passionate about the issue to have a respectful dialogue at the moment, politely terminate or postpone it, reflect on it later. In the words of Confucius, when we see people of a contrary character, we should turn inward and examine ourselves. Release the need to be right. You don't need to be right, and they don't need to end up agreeing with you. This is about us influencing other with relationship, not about changing each other's minds. Practice accepting that other people won't believe the way that you do, and shift your attention to understanding them and having a better relationship with them. We are understanding, not persuading. We are influencing and interacting instead. Now, I'm going to show you a couple really cool examples of this happening. Here is the first one. Now, you'll have to get past the fact that this is a beer commercial when it comes down to it, but it's a brilliant project at the same time. So watch it and then notice what you notice. All right, so question is, how is it that in that interaction that you just saw, two people with polar opposite viewpoints about something that's highly politicized, moralized, how do they end up at the end being friends? What were the things that happened in between that helped to explain that? And also, did you notice that their positions moderated a bit? They may still believe different from each other, but they've influenced each other somehow. All right, anybody else? What are your thoughts about what worked well in that video? And how do they accomplish people with very different perspectives being okay with each other at the end? Now, these individuals had to work on a project together as a team. So there's an obstacle to be overcome, and they're working together to accomplish this thing. And one of the greatest predictors of people recovering from or changing their viewpoint when they have stereotypical and negative viewpoints about a group of people, one of the greatest predictors of whether they will change that perspective is repeated exposure to that individual on a peer level, and all the better if they can instead have to work together against some common foe or challenge or obstacle. So that's one factor, but there are some others too. So two other people have raised their hands, presumably to answer that question. So let's go to John. John, it looks like you can now unmute yourself.
Yeah, one of the things that struck me, and this is why I think reflective listening is so important, is I think she asked him if he was in the military. He said no, and she said, well, I'm in the military. And he said, well, I'm very proud of you for being in the military. At that point, they had something in common.
You're right. They were finding in the process, by giving these individuals questions to answer, they are creating scenarios where they can find commonalities that are unrelated to those differences in political viewpoints. This is a guy, that gentleman that you're referring to, presumably fairly conservative in his ideology. Oftentimes, conservatives will have a lot of respect for military service members. Of course, none of these things are always true for everybody, but when he found out that she had served in the military, then he expressed pride in her already. Now, what he doesn't know yet is that she is transgender, and he has a viewpoint that men are men and women are women. He doesn't know that yet, but he's finding out what they have in common, and he's finding out things he admires and respects in her and expressing them. Now, they also, what they did was they had people use three words to describe what it's like to be them, and then had them to come up with one trait they like in the other person. So intentionally looking for the good in the other person and what you like in them is another strategy that can be very helpful. Now, we also had a hand raised. So thank you very much, John, for that. We also had a hand raised from, I think it was Deborah.
Hi, I just wanted to add that they came together to work together to put this furniture together. And when people have to work together, they naturally see what they have in common.
That's a very good point. There is a book called The Robbers Cave Experiment based on research in the 50s that's probably unethical now, where you saw this happen with two groups of boys at a summer camp who they sort of created conditions where they ended up fighting each other, but then they created conditions where the two groups could instead start to like each other again. And that was one way they did it, was to put them in situations where they had to work together to accomplish something. Okay, so there's a second video I want to show you. This one is some Black Lives Matter protesters who end up interacting with some Trump supporters at a rally. And something very different than what you might think would happen starts to change or shift in this interaction. Look for some signs of some strategies that were used. All right, so what worked? What worked with this demonstration? You have two groups. This looks like a recipe for chaos and destruction. These two groups sort of colliding in this context, but it actually went a very different direction eventually. How did that happen is the question. And people have been typing some things into the chat box, it looks like. They got a chance to humanize each other. That might have been about the last, the previous video. But what do you all think? What are some of the things that helped to, what are some of the things that worked in this video? What I'll throw in while we're waiting for any comments to come in is that this individual from Black Lives Matter, he spoke to the moral foundations of the group that he was meeting with. The first shift point is when the Trump supporters said, we're going to let you come up here and send us your message. That's the first shift, is the willingness to, instead of just sit there and yell and scream at each other, which doesn't seem to get us very far, we're willing to listen to you. And we will give you a couple minutes to send out a message. And what's important is that you have a right to share that message. That's the first shifting point. The second thing is that the individual from Black Lives Matter starts his speech off with, I am an American. This appeals to the patriotism and the in-group loyalty moral foundation that conservatives tend to value on a higher level than liberals do on average. He then clarified that they're not anti-bad cop. They're not anti-cop, because one of the conservative, one of the sort of great conservative realizations, so to speak, is that order is very precious. And when you lose order in a society, then terrible, horrible things tend to happen. And that's part of why some of the moral foundations that conservatives tend to empathize more than liberals still exist and have a strong place in a civil society. So they get concerned when people seem anti-cop, like defund the police, for example, is a slogan that they would view as a threat to order and peace in a society. But when the speaker clarified, we're not anti-cop, we're anti-bad cop, and that we think that if a cop's doing bad, then you ought to be able to fire them just like you fire a bad plumber. This appeals to the conservative preference for meritocratic approaches, to the ability to say somebody's doing good or they're doing bad and they should be accountable for those results. So if you're doing a bad job, then you should be fired. And if you're doing a good job, you ought to be rewarded for doing well. He conceded that all lives do matter. What instead happens sometimes is when a conservative says all lives matter, people say, well, that's racist of you. And then conservatives are very much confused because they're saying, I don't understand. If I think that all lives matter, all people of all colors and races and ethnicities, then how is that even conceivably racist? But this speaker didn't do that. He acknowledged and conceded that there's truth in that phrase, that indeed all lives do matter. And then he clarifies why, here's why we say Black Lives Matter. We say it because, and then he clarified, the intention behind the slogan is not to say that not all lives matter, but to draw emphasis to a group that is all the more targeted than average. He also said, if we're going to make this country great, which is quoting the slogan that a lot of Trump supporters would use, make America great again, we do it together. That is a message of unity and in-group cohesion, which, as you saw, prompted a great deal of applause from the people in the audience. He also clarified that he's a proud American, even said that he was a Christian, and although certainly not all conservatives are Christians and not all liberals are not, conservatives are more likely to espouse, on average, traditional Christian values. So, countering salience bias can also mean you remembering that even though there's a tendency for us to think that things are worse now than they used to be. If you watch a political ad on TV today and then go back and read some of the political ads from the 1800s, you will see pretty quickly that we're at least no longer accusing the other politician of eating babies in the forest and then sacrificing them to Satan. So we have made some progress with political ads over the years, believe it or not. And if you are very liberal or progressive, it might be helpful to also pay attention to the bigger picture, which is that over time, the governmental system has become more liberal in the grand scheme of things. There's some books on that I could recommend later on, but you could filter any political statement, position, or speech through, supposed to say, the lens of cognitive distortions. If you're a CBT theorist and you're familiar with cognitive distortions, watch any political speech and then count and identify the cognitive distortions you see. Do it for the people you support and for the people you don't support, and you will see that both sides are egregiously using cognitive distortions when they get fired up. You can take any political statement, story, or post and then research it and fact check it through resources like Snopes, Fact Check, or PolitiFact. Give you an example. A mental health counselor shared a video on social media, and the video showed police officers using spring batons to break into a building. And it said, police officers caught on tape breaking into buildings to blame it on rioters. And was dispensing this and getting all kinds of hateful comments about how corrupt and evil the police are and so forth, and how we ought to defund them. The problem is, if she'd taken just a moment to fact check it, she would have found out that somebody completely took a video, which if you zoom out shows a Target, not a liquor store like the Post claimed it was, but a Target store, where there was a call from the Target employees inside saying that they had an in-process robbery. The police broke in through the back as well as coming in through the front to make sure they had officers in both the front and the back of the store to apprehend the robbers. And this is all over all of the fact check websites, but she was widely distributing it as evidence of the police involved in another form of corruption. So remember, we are counselors, and in our own social media pages, people will see what we post, and we really ought to check things out before we start disseminating them. Examine the evidence that conservatives and liberals are more unified than divided. I'll show you some resources for that in a moment, because we are. Conservatives and liberals in the United States have far more in common than they have different from each other. You might feel very skeptical about that from watching media, but that is the truth in very objective terms. Identify in specific terms what you're afraid of from the other side, and then keep that and look at it later on. I do this with my clients sometimes. I ask them, identify everything you're afraid will happen if the other person gets elected. And then we track whether these things ever happen, and what you will find is the vast majority of the things that you were afraid of never happened. Limit your exposure to commentary or media that supports bias. Cable news is very biased. You won't find, I'm not aware of a such thing as a cable news station that isn't biased in one direction or the other. And I won't talk about the last bullet point because we really don't have time to on this page. As this relates to codes of ethics, we have to be aware of the impact of the things that we say on public platforms, including our own social media pages. For example, a mental health counselor posted after the fire broke out at Trump Tower, New York City, that they were excited and glad about the fire, which a person died in. When confronted about this, he kind of made excuses and justified what he said. And the president of the American Mental Health Counselors Association then issued a statement saying that mental health counselors are compassionate, empathetic practitioners who want to make a significant difference in the lives of others. We support clients through difficult life experiences, help them with personal issues such as depression, etc. And he did this because people were pointing out this was a mental health counselor. And he wanted to send a statement that, look, in spite of what this one individual is saying on a public platform as a counselor, we are compassionate, and was essentially criticizing that action on the part of that counselor. I have case examples where I help clients to challenge biased viewpoints that they have about politicians through fact checking. There's a case example in the slides about a client who was afraid that President Obama being reelected would mean that his gun rights would be taken away. And we used some standard CBT principles to help him challenge that statement in a non-judgmental way, and then arrive at a more cohesive synthesis. You'll also see an example where I do the same with people who were afraid that if Trump was elected, then they would lose their rights to marriage equality. By actually looking at what Donald Trump had actually said about marriage equality and what his positions were historically. Did want to show you a few resources as we wrap up here. There are some articles I would recommend. I've got a page on my website that is right. I think it's on the next page, actually. No, it's not. Okay, well, it's somewhere. You can check out various articles and news resources that talk about how conservatives and Democrats have far more in common politically than they have different from each other. And also, here are some news resources that intentionally try to give you balanced viewpoints. They'll explain to you the way that some conservative news outlets report on something, the way that some liberal outlets do, and then help you synthesize a more balanced perspective on those news articles. There are lots of books I'd recommend. Here's a great one. I never thought of it that way. How to Have Fearlessly Curious Conversations in Dangerously Divided Times by Monica Guzman. This is from Braver Angels, which is an organization that gets liberals and conservatives together and has them discuss heated political topics and still feel good about each other at the end, creating a sort of a moderating effect. Heterodox Academy is for people who recognize the importance of political diversity in educational settings, like if you're a counselor educator, for example. I have a political dysphoria resource page with lots of additional resources on my website at anorton.com/countering political dysphoria. And then the rest of these resources you can look at in the PDFs later, which brings us to our final polling question and then closing out because we are out of time. If you want to, you can post one word that you'd use to describe this training. What I hope you've gotten from today, though, is an overview of various forms of bias for both forensic evaluation and clinical or therapeutic work, and some strategies for how to become aware of bias and how to compensate for bias in a meaningful way. And you got your CE instructions are in the chat box. I think they're also being emailed to you. And we will very much look forward to seeing you at our next webinar. Keep your eyes peeled because we're going to have several that we'll be announcing in the near future. And if you didn't get to ask your question, send me an email later on. And with that, I think we will go ahead and close out today's webinar. We hope you have a meaningful and restorative weekend. We'll see you next time.